And this National Wellness Institute community conversation is going to focus on our new collaboration with organizational wellness and learning systems, also referred to as OWLS. And we are going to be talking today with Dr. Joel Bennett about a collaboration to bring the Elements of Thriving trainings to your team. We've been working with Dr. Bennett and OWLS for a few years now to bring facilitator trainings around resilience and thriving and empowered health consciousness, and have trained over 300 individuals as facilitators for these trainings. But this is a new collaboration that we're super excited about, being able to offer special discounts to the National Wellness Institute members and bring this to our community. So I'm going to go ahead and let Dr. Bennett tell you more about what we have to offer here.
Thank you so much, Trina, and welcome everybody. And I just want to acknowledge Trina has been an amazing partner in helping to bring these types of events about. So just a shout out to Trina Lauby from the National Wellness Institute. I'm going to just show my webcam here for a minute just so you can see me. I'm going to launch into the slides straight away. I will come back at the end of the presentation and show my webcam again, and hopefully you'll have some questions to help me make this clear as possible for you. So I'm going to get started. So today's presentation is about resilience, thriving, and health consciousness, direct to team and group workshops. You'll note that at the National Wellness website, there's this nationalwellness.org/owls_teams. You'll learn a lot more about what we're doing. There's an email that you would get from us that gives you all of this information in depth that I'm about to share with you. So if you miss anything that I'm sharing here, please refer to these documents. The outline for my talk today is a little bit about us, why these workshops and why now. What do they do, both the content and the process of them. I'll talk a little bit about our previous evidence and how it works if you decide you want to go ahead and engage with this process, and then we'll have Q&A. But before we get to why, I want to know a little bit about you. So Trina's going to launch a poll here, and this gives us a sense so we can customize and speak to your interests. So Trina, you ready to do that? Great.
Sure am, yeah. So on your screen, you'll see our first poll question, and we're just asking, what is your primary professional role? So which one of these fits you best? Are you a health and wellness coach or a mental health professional or educator, human resources or employee benefits professional, workplace wellness professional, a business owner, manager, or executive, a student, homemaker, or something else that we didn't include on the lists above? So you can just click right on your screen to let us know your primary professional role. I'll give you all a few seconds. It looks like most people have had a chance to answer. Okay, Joel, we have 33% who fall in the first category of coach, mental health, or educator, 13% in the human resources or benefits. Our biggest group is 50% who are worksite wellness professionals, 4% who are business owners, managers, or executives, and no one's fallen into the last category today.
Okay, well, thank you, everybody. And so workplace wellness is where, and health and wellness is what I'll be focusing on. So that's our first poll. And then we have another one, which best describes your work on resilience and thriving. That'll also help me as well.
All right, so is this a new topic to you? Have you studied these ideas? Are you using them in your work? Or do you see them as being essential to your work currently? And again, just a simple click on your screen to let us know which best describes your work on resilience and thriving currently.
And thanks again for taking the time to fill that out.
All right, just a couple more seconds here. Looks like some people are still reading through the answers. Okay, let's take a look at the results. Okay, we have 19% who say this is a new topic to them, 15% who have studied these ideas, 42% are using them in their work, and 23% who say they are essential to their work.
Wow. Okay, you 23%. I really want to hear from you what you're doing. That is exciting, and those of you who've been using it also. And we'll make sure those of you who are new to this, you'll get some basic ideas as well. Okay, so proceeding then, get more into a little bit about owls. Just a couple of quick notes here. We are really about evidence-based wellness. We've received over 6 million or close to $6 million in funding to do clinical trials, a number of them devoted to this topic. Our mission is research to practice. We've trained over 500 facilitators. Together, we've estimated reaching 250,000 employees, and we have lots of research you can access on our website or through any email to me, so you can learn more about the science behind what I'm going to be talking about. This next slide just has a lot of information on here. On the left are different books that we've written that have been applied on healthy leadership, leadership resilience. Raw Coping Power is our primary resilience text, and Wellbeing Champions. We've been acknowledged in a number of different places. We're especially proud that the Surgeon General acknowledged our work in the Facing Addiction in America report and the role of resilience there. And on the right, you can see some of the different companies and organizations that have used some of our materials. So why these workshops and why now? And you'll see on the bottom there is a link. If you again want to know more about all of this, just follow that link. Now, I'm going to tell you why I think these workshops are important and why now. But you're going to get a chance to tell us as well. And that's where you can fill out another poll, but also use the chat function. There are three main reasons at the broadest level. And resilience, which is generally defined by the ability to bounce back from stress, but also learn from stress, and also transform stress into a positive function, which is the thriving component. So before I get into this, I just need to clarify for those of you who are new to this topic, resilience is not just about bouncing back. It's about learning and learning how to transform or bring out the potential of stress. So why do we need this? Well, there's increasing complexity in our culture, especially in the business world and the economy. There, as we've seen, we've had a lot of social polarization, political polarization, and we know that stress impacts all workplaces of all types. And I call the three beasts here are, if you've not heard about VUCA, which is volatility, uncertainty, complexity, and ambiguity, you can Google VUCA and you'll understand all the work that's happening around that. There's burnout, and then there's what we call technophilia, which is an addiction to technology. And those things are really getting in the way of our being able to be resilient, to be able to be positive. The three pieces associated with burnout are fatigue. We know from the research that there's increased fatigue in our culture, especially in healthcare professions. Those of you who are working in wellness or affiliated with wellness, there's compassion fatigue. And then also secondary traumatization, which is actually increasing a little bit now, more, not a lot, because of COVID. So this is the first reason why we need this kind of training. The second reason is that social technologies, an incredible increase of team-based apps that are used in the workplace. And you can see some of those in the right. But by themselves, these technologies challenge culture of health initiatives that value presence, authenticity, and connectedness. That is, the apps by themselves may be useful from a task-oriented and to some extent social-oriented perspective. But if you really want to create a healthy culture, there's a right way to use them. So that's another reason why the kind of training I'm talking about would be useful. And the third, and probably the most important reason, is that hundreds of workplace studies show that social connection, social support, time for getting together, and team-based programs are essential to personal well-being. I can talk a lot about this, that bringing people together with a sense of connection is almost a foundational component of any effective health promotion or wellness program or organizational development program for that matter. So those are the broad ideas, but why specifically resilience? And you'll see there are 3 books here that, or actually the National Academy of Science report on clinician burnout. And all of these really show that there's increasing burnout, again, especially in the healthcare professions. Jeffrey Pfeffer's book, Dying for a Paycheck, clearly articulates how $300 billion a year is spent by corporate America and businesses on dealing with stress. The deaths of despair, which the Case and Deaton work on the increase in suicide and alcoholism that happened pre-COVID. Now we have, of course, people dealing with the stress and reactivity due to COVID. But again, it's not just managing, but learning from stress and growing as well. So this is why we need resilience. There are major forces in our culture that point to the need for this. Why health consciousness, which is our other course. So here, you've got Carr's book, What the Internet is Doing to Our Brains, The Shallows, Dope Sick on the opioid epidemic, and the dark side of social media. So what we know is that schools, preschool, school, high school, we're not getting trained on healthy media boundaries. Social media and other types of internet processes are taking over, and we need to be more mindful of how we digest these things. We also know from research that perfectionism in college is on the rise and anxiety associated with that. There are some, if not a lot, of studies that show that internet-driven attentional problems and distractibility, of course, the increase of internet and smartphone addiction. We are overfed and rely on prescription drugs. The opioid epidemic was the previous epidemic and is probably still going on despite what we're seeing. And again, not just technophilia, but pharmophilia. And I've written about that. That is the addiction to having to have some pill, some drug for everything. So health consciousness is an antidote to that. So those are my thoughts about why I think these programs are so important now. But we really want to know what you think. And am I understanding right that, Trina, when you answer these questions, you can also provide in the chat box more information about why you made the choice that you did. So why do you think we need these types of trainings? What's your top opinion? So Trina, I'll turn it over to you.
Sure. So again, you can just pick one answer here, looking over what is your main reason, in your opinion, that we need resilience or health consciousness training? Is it the increasing business complexity and stress? Social technologies not authentic enough? Social support is essential? Need for healthy boundaries on the media or the internet? Or emergent issues like epidemics such as opioid or COVID-19 that we're seeing now?
So we know that these, go ahead.
We're just gonna say you can click on your screen which one is the main, but then you should also be able to enter into the chat if you have other thoughts or reasons that you want to share.
Thanks, Trina.
And you'll find in the follow-up survey that pops up when you leave this, or you can also complete it through the link in the follow-up email, that we're going to ask this question too, so you can share some more thoughts with us, because we would like to hear what you're thinking is your main reason that we need resilience and health consciousness training. All right, let's see what people said. Okay, Joel, we have our biggest group is 52% saying increasing business complexity and stress. 0% with the social technologies aren't authentic enough. 17% social support is essential. 10% need for healthy boundaries on the media and internet. And 21% with emergent issues and epidemics.
Okay, great. Thank you so much. And then we'll try and speak to these issues as we continue with this presentation. Thank you. So let's talk about team resilience and the importance of team resilience and group cohesion. There is a document that is a handout called Team Resilience Research Papers. We've been studying and doing training in team resilience for over, well, close to 15 years now. And I'm really seeing an uptick in the research and potentially the application of these concepts of team resilience. So what I want to clarify is, what do I mean by who receives this? So, at the most basic level, if you have to get your foot in the door, it's a lunch and learn. But it could be part of a retreat. You can do this with Chamber of Commerce. It could be a growth party, which I'm happy to talk about what that is. You can do this for new hires to kind of, part of the onboarding. We care about you. But it could be a church group, gift to friends and family, neighborhood, sports team, part of a reunion, association meeting, business group, leadership development, or just celebrating staff. So the idea here is that we want you to really think outside the box, especially those of you who talked about emergent issues like COVID, that this is not just affecting workplace, it's affecting the border between workplace and home. And so this is where we need a lot of these types of social tools where people are coming together in an authentic way. Now, I love this slide because team resilience has been around from the beginning of time. And I don't know if you know, in the upper left-hand corner, we have the Poseidon adventure where you're thrown together and you have to figure it out as a team. Or you can be Frodo in the Fellowship and you're trying to figure out how you're going to be responsive to the calling that you're set. Band of Brothers, World War II, or maybe you're wanting to conquer the threats to the universe as the Avengers. Or at the bottom, maybe resilience is because you like to create mayhem in the Little Rascals, or so there's a variety of things here. The other image on the bottom right is the Trail of Tears, the Cherokee Trail of Tears, and many stories of cultural and racial response to adversity and trauma, or use the force. Now, I am kind of painting a broad swath here, but the point of this is that this idea of team resilience is written into the DNA of humanity, but we take it for granted. And it often is the case that we don't think about it until there's a crisis. It's like, oh, everybody got together through that crisis. And you're seeing that now with COVID, but you see it all the time. So instead of reactively creating team resilience, let's proactively do it. And that's what this training is all about. And as you'll see, there's a lot of research on this topic. So what do these workshops actually cover? So I'm going to cover the content briefly, there's a lot, and then I'll talk about the process. So the Resilience and Thriving curriculum objectives, again, these are all in the documents that you can see. And I'm not going to read all of these, but you're basically helping people to understand the difference between stress, resilience, and thriving. And there are a lot of cognitive behavioral tools and techniques for transforming the stress into a positive factor and recognizing healthy alternatives. So the objectives are really skill-based, but they're also about learning these skills together as a team, which amplifies or has a multiplier effect. Some curriculum features here, you'll see that people get a PDF of the slide deck, the workbook, they get a copy of our book, Raw Coping Power. And some of the concepts that we cover, you can see here. We're very, very, very strong on resources for getting help. If you're in a workplace setting, we always integrate this if we can with employee assistance or other behavioral health resources. And we look at the 6 domains of well-being and how stress, thriving, and resilience operate across all the dimensions of well-being. In fact, here are 2 examples of exercises. We actually do flip chart team exercises. We do those online as well as in person, and you'll see more about that. And then you can see on the right here an image of these different levels of coping, resilience, and thriving across the 6 dimensions, the National Wellness 6 dimensions of well-being. These tools have been used to help people start to identify stress and how to get to a new level of working through stress so that it's not just resilience, but thriving. For health consciousness, the curriculum's related but different. A lot of the health consciousness curriculum focuses specifically on emotional triggers and how we respond to those emotional triggers, setting goals, taking steps to implement healthy options. And because this was originally funded from a grant from the Substance Abuse Mental Health Services Administration, we are really clear about recognizing the risks for prescription misuse, not only in oneself, but in vulnerable family members, aging parents and teenagers. So there's a component that talks about how do we respond to triggers without having to resort to prescription drugs if possible. So this is a curriculum features. You can see here some samples. We do a lot about learning how to identify those triggers. Of course, pain is a big one, but fatigue, anxiety, irritability, and others. And then we do a lot of self-assessments as well. So learning to understand what level of health consciousness you're operating at. So that's the content. Now, what are the processes? What do these workshops actually do from a process perspective? There are 5 main processes. Number 1, everything we do is not only evidence-based, it's strengths-based. So we're not talking about lack. Of course, for consciousness and thriving, we're talking about supporting the evolution of the team, supporting the evolution and the positive aspirations of the team. Very social, interactive, again, online or in person, lots of use of chat. Confidentiality is critical. We always customize as much as we can to the local occupation, as I mentioned before, resources as well. And those not only resources if it's EAP, but community resources as well. So here's an example, of a strengths-based exercise where people are sharing these are actually the 6 fundamental features of health consciousness. So which of these is your major strength? And we talk about those. We really look at focusing on psychological safety and what's happening in the group socially and putting them together so that they work for you as the client or customer that brings us in. Here's an example of when we do in person, the kind of work that we do, lots of interactive activities. This was with an academic organization. Here's another group photo. We have lots of these. This was with the Louisiana Office of Behavioral Health. And we also have facilitators as well. So we do a lot of online training, and a number of these people do online, and we did an online workshop with them last month. So we have both online and classroom. We do a lot of polling. So for example, depending on the group, this is an example poll that we use in our online programs. What do you want us to focus on? Just like we did with you a few minutes ago, we asked you questions, so we also get this and we do our best to speak to the interests of the group. Again, confidentiality is critical. We use a number of frameworks to ensure that. And most importantly is we ask everyone who participates to agree to these chat guidelines: confidentiality, honor, anonymity, and team trust. So this is a quote from Brene Brown. In terms of process and not just content, is a lot of what we do as a facilitated training. It's not just PowerPoint, and it's definitely not didactic like I'm talking with you right now, but it's really engaging. It's about helping people to share. And a lot of what we talk about in resilience is our resilient story, not just a story of our resilience as a person, but as a team. And when we come through COVID, for example, there are going to be stories, and it's going to be so important for people to share and share their strengths around that and to own those stories. So this is a wonderful quote from Brene Brown that really speaks to the heart of the process that we use in our training. So previous evidence for this, and again, there's the articles that I mentioned in the team resilience research papers that are available to you. We have done a number of studies. As I mentioned, we've done clinical trials, and the different programs that we have used, this is part of it, we found improved well-being, increased use of healthy coping, less unhealthy unwinding, reduced stigma for help seeking, reduced personal stress, reductions in counterproductivity and problem drinking, and actual increases in help seeking. In one study, we actually were able to show an increase in EAP utilization, coworker responsiveness, and knowledge of policies. Now, on the left, we have a paper that we're working on right now where we find that these outcomes may be actually driven by improvements in the healthy work climate. So instead of focusing only on the outcomes on the right, we believe that when you focus on that team, when you focus on the social capital, you actually improve the work climate, And that has a sustainable and what we call mediating effect on these other longer term outcomes. So our programs are not just focused on those individual outcomes, but through the team approach, we're actually beginning to improve the work climate. Some examples here of some testimonials. We did a resilience initiative for Staywell. Catherine Kelton, Chief People Officer of Staywell, this is a part quote. The outcomes were impressive. We enhanced perceptions of resilience at personal, team, and organizational levels and made concerted efforts at real, authentic communication. Our culture has measurably improved, and we have tools and structures that we use well into the future. Our work with OWLS was a success by all measures. Recent health provider participant, the participation and information provided was inspirational and uplifting. And then a municipality, the internal HR there saw these other outcomes that were hard HR outcomes in terms of sick days and injuries and so forth. So we've been doing this work for 20 years, and now we're really excited to be able to bring it to you through National Wellness Institute. So what happens, and I'm almost done here, Trina, so we'll have a lot of time for Q&A. But what actually happens when you want to actually engage us and use these tools? So the first thing is you would go to that nationalwellness.org/owls_teams, and you'll be sent these preview materials that I showed you earlier. And those preview materials are very in-depth, and they have links to other materials because we are so science-based, we want you to know everything as much as possible. So we try to make everything as transparent as possible to you so you can look through it, think through it, see how it applies. So that email autoresponder describes your options. It describes the methods. Again, we do this online as well as in person, and also gives you some basics on pricing. I will mention that because of scalability, pricing varies a lot. So more than likely, should you have an interest, we'll probably have a conversation about that. So we contact you at your convenience to have that conversation, and you can let us know whether you want to have that conversation. Then at that point, we review the different options, like what's the size of the group or groups that you have, what's the venue, is it online, and do you have an EAP or other resources that you want to integrate? We're very strong on not recreating the wheel, and we believe that all of you who are listening to this, part of our raw coping power motif is that you probably already have a lot of the resilience resources that you need. It's maybe that you haven't fully optimized them, and that's what we actually do. So we're here to help you optimize those different resources that you have and scratch a little bit below the surface so that you can optimize them. So once we go through all of that, then we schedule the training. We usually require a minimum of 2 weeks. We've been able to do that, get a quick turnaround, and we do registration for you. We have all the different methods for getting the materials to individuals. And then after we schedule, we deliver. And then we always include an evaluation component, just like NWI is doing today. And that evaluation component is also customized so that using SurveyMonkey or some other tool, we will add in questions for things that you also want to evaluate. So you're getting sort of consistent with everything we've done, a real catalytic, if you will, opportunity to build that team resilience and sustain it through the evaluation data. So to summarize, I'm going to talk a little bit about the difference between health consciousness and resilience, just so I can leave you with these concepts. When you look at the bridge on the left, you think that this is not the bridge I want to walk on compared to the bridge on the right. Health consciousness is the bridge that allows us to bridge over the moment of the trigger, whether it's a stressful trigger, whether it's a reactivity, whether it's anxiety, whether it's pain, whether it's loss. Health consciousness is that fundamental application of mindfulness to our health and well-being so that we don't react, we don't get caught up, if you will, in the moment. And so what you're doing in building the health consciousness skill is you're moving from the bridge on the left to the bridge on the right. However, we have to walk on the bridge on the left because that's where we learn to get our footing. So health consciousness, the training really is about helping us to understand these moments of reactivity. And what we're seeing with COVID is that there are some people who are thriving with it, but there are some people who are very reactive. So that's an example of how you see these stressors playing into health consciousness. So that's a very quick thumbnail of what health consciousness is. Resilience is the journey. It's multiple bridges over time. It's a much more dynamic process of learning and growing and thriving. And so you're building a scaffold that is allowing you to understand that story that Brene Brown talked about, and to really see not just the bridges, but the junctures, the cliffs, and of course the vistas that our life is about when we are on this journey of resilience. So in the training, we help people to have this conversation about my resilience journey and about my health consciousness. And it really is transformative to see what happens. We had a recent training where we had 2 sessions. In the first, we had someone with COVID-19 come to the session, and they shared all of what was going on with them. And afterwards, in a second session, they came back and talked about how they applied the tools. So we provide worksheets that allow you not just to use the training when you're experiencing it, but you come back and you use a worksheet and you can continue to apply that with your group. So I'm going to show you a quick video that also explains our approach to resilience in a nutshell. So hopefully that came across clear. This is our last slide. Again, very excited to continue this productive and fruitful relationship with National Wellness Institute. As you can see, we weave in the 6 dimensions of wellness into both the health consciousness and the resilience course. And it's really about moving from that stress, evaluate, cope to the evolve part. And that's what we're here to help people with, is to help you evolve. And so Trina, I'm hoping that that's clear, and I'm ready to take any questions that are coming in.
Great, thank you so much, Joel. And this is the time that we're going to open it up for questions, so you can type those into the questions box if you have them. Just a couple of reminders as you're typing in those questions. We will have a follow-up email this afternoon, so we'll provide some of the links that Joel mentioned. You have the opportunity to sign up for more information and get those handouts with lots and lots of more detail and links. But we hope if you have questions about the content or about how this works, how you can bring these team trainings to your groups, that you'll go ahead and ask them now or reach out to us in the future. All right, Joel, so we're going to ask just a couple questions here. Can you share a little bit about how the online trainings work and how you keep that an engaging process?
Yeah, sure. Well, first and foremost, we limit. We try not to have more than 25 in the room. And so we encourage use of webcam. We use Zoom, but if you have another technology you need us to use, we'll work with you around that. We have a lot of interactive exercises. So for example, I mentioned this flip chart. So when we ask, what are you experiencing right now in terms of your stress? We'll type up what they're saying, either they're saying or putting in the chat box. And what we find very often is that we encourage other people to share, oh, I have that too. And so you'll see that kind of camaraderie starting to happen. So that's one example of how we do that. Because we use, this is evidence-based, so there's a clear fidelity to curriculum, there are worksheets that we ask people to complete. So when people are completing them, we ask people to volunteer sharing, and they always do. And there's always, pretty much 100% of the time, because of the chat guidelines, people share some very, very real information. And so we are facilitating the people to learn together. And one of the things that happens, not all the time, but often, is people who might be coworkers or have known each other for a while discover something new that they never knew before. So they understand, for example, oh, you have a son with this disease. My son has that disease. Or I'm dealing with an aging parent. I'm dealing with an aging parent. So as soon as those things happen, then it creates this sense of, that social connection, and other people experience that too and chime in. So it's really a facilitated space, if you will. I hope that answers that question.
Yeah, thanks. And we know many people are working from home right now. Is it possible to do these trainings with people in their own homes to get the materials and to
Oh
actually
yeah,
do them?
we just did that last week. We had a total of 4 sessions, 20 to 30 each time, and we reached 100 people, and I think all 100 were at home. They were for an organization, and we worked with that. In the past, when we weren't at home, we worked with organizations that have virtual teams and remote workers. So we have hybrid as well. In some cases, we have maybe when people are back at work or in a setting, there's some people who are sitting around a room, so I can see the group of 5 to 15 people around the table, and then there's a 1 or 2 or 3 or however many people who are sitting at home. So we work in both hybrid, classroom, and in home only.
All right, thanks, Joel. And how long are the sessions?
We really think it's not possible to do this in less than 90 minutes. We will work with you to do it in 60. There are preparations to be made in terms of getting the worksheet beforehand, making sure people fill that out. So we can do these in 60. However, according to, quote, scientific fidelity and having impact, we do recommend a minimum of 90, and usually we don't go longer than 90. If you want to do it more like a retreat, which is, longer, we can do that, but 90 minutes is the general rule.
Okay. And do you recommend making the trainings mandatory?
Well, that's let's ask the people in wellness that question. I think the people here can tell me whether they think this should be mandatory or voluntary. Really, I mean, that's an ongoing question in our field. I will say, though, that strong encouragement from leadership is as close to mandatory as you get, especially when you're saying we really care about you, especially during this time, or because we want to prepare you. I think that's one of the silver linings that COVID will present to us, is that people will go, we need to do more of this. And so having that strong leadership message, and we do that. If you want to bring in a leader before we get started, we find that very helpful, that at the very first few minutes of our presentation, somebody comes on and says, thank you for being here. Or if you want to tape record somebody, we can put that in as well. And that's another effective way to make it voluntold.
And if if we have a large number of employees, do you have a suggestion as far as who we might start with this training?
Yeah, so that's where the consultation comes in at the beginning. So what we have found is if you have a limited number of employees, then the ones that you select at the beginning could be critical. And so it's a mix of your sort of easy pick early adopter wellness champions, but not just going with them, but also getting people out who are sort of the naysayers and having them in the mix, and having as much diversity, of course, as possible at all levels, not just gender and ethnicity, but seniority and so forth. So we encourage you to think carefully about who you're bringing in at that first level. Of course, if you have a wellness champion network or ambassadors, they're also a great way to start off doing this.
Great. And is there an order to these trainings? We've got with the two options available?
Um, I really think, I believe that health consciousness is fundamental. So if you wanted to do both, then I would always start with health consciousness. However, I know people don't know about that. Resilience is much more of a buzz. So we can talk you through what that looks like. And I think the main thing is whatever you think will get people into the seats.
Okay. And are you able to record sessions for participants who can't attend?
We don't do that because of the confidentiality guidelines. Because we're creating a safe space, and that's sort of like been our 20-year heritage. We don't record because people say stuff that they may not want to have out, and we don't like to go through all the logistics of doing that. It's not your standard program. It's a facilitated group team resilience program, so we don't record.
And I will say, having sat in as the host during our facilitator trainings for these, that they are very interactive with lots of tools, and the testimonials we've received from those participants are truly transformational. So, is there anything you'd like to add before we wrap up, Joel?
No, I just hope people watching this now or recording, please contact us. I have found that even if you have a small interest or an inkling that this could work, you never know what the conversation will bring, whether you use our materials or not. Very often what happens is people listen to this and they feel a validation or affirmation, and then that helps them on their own journey. And that's what we're all about, is helping you on this evolution, whether it's consciousness, resilience for yourself, for your team, or hopefully for your entire organization, like we saw that happen with Stay Well. So please don't hesitate to contact us.
Thank you so much, Joel, for all your work that you continue to do in this area, and to all of you who are listening, for the work that you are doing that is so, so important now and in the future.
Thanks,
Thanks.
Trina.
Yep. Be well.
Be well.